If you've had a total hip replacement in the last week and you're ready to move forward with your recovery, you are in the right place. Today, I'm going to show you 7 new exercises that you can do post-op weeks 1 through 4. Hi, my name is Kathy, and I'm a physical therapist, but be sure to follow your surgeon's specific hip precautions because you want to stay safe. If you've had an anterior approach, you may have the precautions of avoiding excessive extension, especially combined with external rotation. And if you've had the posterior approach, you're going to want to avoid flexion more than 90 degrees, internally rotating your hip, and crossing your legs over midline. That means no bending over and no crossing your legs. Now, the goals during this phase of recovery are to begin strengthening and improving range of motion and improving your gait quality. During this phase of recovery, you're most likely still using a walker, and at the end, you may be transitioning to a cane if your gait is starting to normalize. Now, what I mean by normalize is that you can walk without a limp, your legs feel safe and confident, and you can weight bear equally on both sides. As we begin the exercises for phase 2, you can continue with the exercises from phase 1. We'll just be adding in more strengthening range of motion exercises. Now, the first exercise we're going to do is a modified bridge. We need to modify this to avoid excessive hip extension, which is one of the precautions that you have if you've had the anterior approach. So what I'm going to do is bring my feet a little bit closer to my buttocks. I'm going to put a towel roll in between my legs to make sure that I don't rotate my hip. And I'm just going to lift up, but not all the way like you would with a normal bridge. I just want to come high enough that I clear my buttocks from the table and then come back down. Now, as I'm doing these, I'm going to make sure that I maintain normal breathing because I don't want to hold my breath. And I want to make sure that I keep a little bit of a flexion in my body. My body's not completely straight as I'm doing these. Now, you'll start with about 10 of these and slowly increase to 2 sets of 10 as you get stronger. Now, the next exercise I'm going to do is hip adduction. Now, you want to have a towel roll or a large pillow or a ball between your legs because you want to make sure that you don't cross midline with these. So I'm putting the pillow between my knees and I'm giving my legs a squeeze together, and I'm making sure that I maintain normal breathing at all times and relax. So you'll want to hold these between 3 and 5 seconds, making sure your hips don't pass midline. The next exercise I'm going to do is a straight leg raise. I'm going to bend the opposite leg, tighten the muscles on the front of my thigh, and lift my leg up to be about even with the other leg, and then slowly lower it back down with control. Now, this one is going to be quite difficult, especially if you've had the anterior approach. So if you can't do 10 to start, just start with maybe 5 or 6 and build up as you get stronger. If you find that the straight leg raises are too difficult for you, just keep on with your short arc quads from phase 1. Now, the next exercise we're going to do is single limb marching. What we're going to do is just lift up the surgical leg, making sure that we keep it below 90 degrees so that we get a little bit of strength in the front of the hip. Again, you'll do about 10 of these. The reason we don't want to lift up the non-surgical leg, because that would mean all of our weight is on the surgical side, and we're probably not quite ready for that just yet. So when you're doing these, you want to make sure that you're only lifting between 45 and 60 degrees because you want to make sure that you're not getting to that 90 degrees. From the side, it would look something like this. Now, if you're doing these at home, you'll want to be either using a sturdy chair, a walker, or maybe standing by the kitchen sink. Now, the next exercise you're going to do is hip abduction. You're only going to move the surgical leg, and you're going to want to make sure that you're keeping your toes pointing forward because you don't want to externally rotate or internally rotate your hip with this. Now, the leg you're standing on, you can have a slight bend, and you're just kicking right out to the side for 10 repetitions. And if you can, you'll do 2 sets of 10. If you can only do 1 set of 10 to start, that's okay. Just gradually increase as you're able. Now, the next exercise is hip flexion. I'm just going to be kicking forward, not too high, and we're just doing the surgical leg. We're going to do 10 repetitions of this as well. From the side, it'll look something like this. We're going to keep our back straight. We're going to keep our core muscles engaged by drawing our belly button into the spine, and we're just kicking forward to a comfortable position. So the next exercise you'll do is some simple weight shifts. You'll stand with your feet flat on the ground, about shoulder width apart, and what I'm going to do is just gently shift my weight over to my surgical leg. I'm not going too far though. I just want to feel the weight going directly from my hip down to my foot, and then I'm going to shift back to the middle. This is going to be important later on when I'm learning to walk without an assisted device. I'll be used to having some weight on that surgical limb. So we're just shifting over and back to the middle. As you're doing these exercises, remember there's no reason to rush. Just go at your own pace, and if you'd like, you can continue doing phase 1 exercises as you incorporate these new exercises into your program. Now, these exercises are going to help you start to walk more normally and regain your strength. If you found this video helpful, please watch the next video here.